Thanks everyone for attending this panel today. So we're talking about design and healthcare. Specifically, we're talking about how data visualization, behavior change, and user-centered design can help us design and create better products and experiences, especially in the context of healthcare. And the people that I'm very fortunate to have with me on the stage today are all designers. So as you've heard, we have Steve Dean, who will be speaking to us about service design. Dustin DiTommaso will be talking about behavior change, and Molly Lafferty will be speaking about data visualization. And the purpose of the panel today is really to kind of give you a high-level overview of these topics, get you excited, present some case studies and some examples, as well as give you some tips and things that you can take back to your organization. So before we jump into the speaker talks, I should have said, so each person on the stage is going to give about a 10-minute talk. Then we're going to have a discussion as a panel and hopefully save a little bit of time at the end for Q&A. But before we do that, I just want to kind of talk for a minute about what we mean by the word design. So who in this room is a designer? Great, few hands. Who is more of like an IT tech engineer person? Okay. Who is a provider, like a doctor or other type of provider? What about entrepreneurs? Seems like we have a really even mix in the room. So when we talk about design, we're talking about more than just making things pretty. We are talking about kind of complex problems, and as designers, we are really problem solvers. So we're looking at systems, we're looking for breakdowns in systems and opportunities for making systems better. We are also paying a lot of attention and time understanding the people who are using systems. So we want to understand their goals. We really want to help understand how to make them more successful. And of course, Steve is talking to us about systems, and Dustin is going to help us understand how we can make the people using our products and systems more successful. So we're not only talking about the people, but we're also talking about the business and the technology, because we want to create solutions that are not only desirable to people, but also feasible from a technology perspective, and of course viable from a business perspective. And that really are well situated within the greater kind of system or ecosystem in which our product or service is situated. So we're also good at visualizing abstract concepts and making data understandable and increasing the emotional impact of data, and that's something Molly will talk to us more about. And if we've done our job correctly, our users use our system, our service, our product, and say things like, you know, it's useful, intuitive, beautiful, it's easy, and that's what we're really after as designers. So the panel members are going to speak to us more about all of these topics, and I'll kick it off with Steve Dean.
Thanks very much, Katie. So just a heads up that my screen here is not matching this, so you're going to see my head move back and forth a lot throughout this talk. So thank you for, it's really great to be here. It's great to be on this panel with Katie and Dustin and Molly. What I want to just try to tee up for us today is in thinking about what the word design really means. I want to unravel that a little bit for this group. So when we talk about design, in the most basic way, we talk about bridging a gap between what currently is and the state of things that we have and what actually could be. This is a basic definition, thinking about design, that I want to start the group with, and then move into thinking about what each of us think about when we hear the word design. So often, many people think about furniture design, fashion design, and also the design of spaces. So in the design field, we train industrial designers, product designers to make things. We train architects to design spaces. We even train interaction designers to design websites. But 80% of our economy is made up of services, and everyone in this audience is well aware that what we are delivering in the healthcare field are services. There are products and there are things, there are physical things that are part of those systems, but we are ultimately delivering services. And what we are just at the beginning of in terms of training designers is to train in a very systematic way to bring the tools and the methods that we've used in traditional design, both architecture, furniture design, industrial design, product design, into the design of services and the practice of that. So this is Melissa, and when we think about healthcare now, and we think about the design of the service of healthcare, this is Melissa, who's a type 1 diabetic. And when we think about that, we have to think about all the various components that come together to make, to help Melissa both manage her disease, her type 1 diabetes, whether that includes keeping track of the record keeping and things. So you start to realize when you think about, say, a patient, and a patient with, like Melissa, with type 1 diabetes, you begin to realize that there are lots and lots of pieces to the puzzle. And how do we then apply some of the practices that we've all been trained ourselves here on this panel in the field of design to design the services that are much more complicated than something like a chair or other industrial design products. So what we're seeing in the design field and in the field at large is that there's a shift from the designing things to designing systems. And even further, particularly within this audience here, it is a designing systems of systems, which it gets quite complicated and quite complex really quickly. So this is a panel talking about visualization. And designers are traditionally thought of as individuals who can draw, who can diagram, who can make things explicit and visualize them. So we have tools to do that in the field of, say, furniture design, or in the field of shoe design or fashion design. Even in architecture, we have the tools of architectural blueprints to diagram out what it is that we're going to build. In interaction design and web design, we have wireframes. Many of you are familiar with those, and we'll talk a little bit more about that. But in the world of services, which are complex, hairballish, how do we model out, how do we map out, how do we diagram and visualize things as complex as the system that Melissa, a type 1 diabetic, interacts with, engages with on a daily basis? So what do we draw? We draw models, and I'm using this word as a way to describe the importance of what we do as designers, that models and modeling systems and modeling product service ecosystems in particular are very helpful to us in the form of design. So these models, diagrams, visualizations, one of the things that they help us do is they help us be very explicit about the systems that we are designing, the systems that we're talking about. They also help essentially reveal and expose a language that we all share around that particular system and around that model. Each of us, when we think about Melissa and type 1 diabetes and all the aspects and the products and the services and the behaviors that are involved in managing diabetes, we each have a mental model about what is involved in doing that. So by diagramming and drawing out models, we expose that language, and we can then, as a group, convene around a shared language. The other thing that these models help us with, in diagrams and visualizations, is they help essentially expose all of the mechanics and the components of that system. And what that does, what it helps us to do as designers, is to reveal what it is that we can improve upon that system. Most importantly for us as designers, one of the things that we want to do, particularly in some of these complex systems that we all work on and design here in this group, is to remove some of the complexity. So I'm going to show you an example of this. This was working with a large disease management company and health coaching company that's been around for about 30 plus years. They came to me and said that we want to do a complete do-over. There was an opportunity to start from scratch. They had an enormous amount of products and service lines within the organization. And the kind of just high-level description is that this company is a complex service ecosystem, and it's comprised of products and services and people, all of these things that work together to essentially deliver a disease management program to members of a health plan. So the goal of the engagement was to design the future state of this system. So they had an opportunity to essentially perform a do-over. I said to them that in order to do that, the most important thing that we needed to do was to model out the current state of the system. So there was no single view of the entire complex product service ecosystem. So in managing and modeling and building out that current state, by making that explicit, we had an opportunity to design a much better future state. But we couldn't do that without understanding what the system looked like today. So how we got there. Remember that we're designing, as designers, we're sort of closing that gap between what is and what could be. So we start over here on the left-hand side with what is. So this is the concrete notion of what that service ecosystem looks like. What we then had to do is abstract it, and Katie talked a little bit about what designers are really good at is abstracting these very complex systems. So we modeled out the existing service ecosystem, and I'll show you an example of that in a minute. So we took a model of what is, and we used that as a starting point to prototype new opportunities for the future state, which then eventually led to what that system could be. So what did the current state look like? So we performed lots of tasks, and this was essentially an exercise in exposing all of the pieces of the product service ecosystem within this organization. So we did a product service inventory, lots and lots of product lines and offerings. They had a very expansive print-based product that also was delivered through these disease management programs. So we sorted and mapped and organized and categorized. Something else that designers and design thinkers do a lot of, which is organizing large sets of complex information. We did something that we called a stakeholder mapping, and this exercise was to really expose all the various stakeholders within the organization, both internally and externally, what kinds of participants, users, members that they had, the different roles that they played. The health coaches that they had various roles, from exercise physiologists to registered dietitians to behavioral psychologists. So it was an opportunity for us as a group to really put up on a wall, diagram in a visual way, every stakeholder that was involved in the organization. And we used all that information to essentially model out what is the current state of the surface ecosystem. And so what we created was essentially like a straw man in the form of what we call in service design something called a service blueprint. And this service blueprint, not unlike process flow diagrams, but it's really directed and driven and built from the perspective of the end user, the user who they're engaging with. So the service provider, whether it's the health coach or the nurse or the disease management client, all of this stuff was modeled out on these service blueprints. And then we brought in the team and we asked them to look at this large, expansive diagram, this service blueprint, and tell us what we got right and tell us what we got wrong. And the goal of this exercise, as I said earlier, was to expose and make visible the current product service ecosystem so that we could all see what the components were, the mechanics, and the levers. We used that to then design the future state. So once we had exposed the current state, it helped us with a number of things. One, removing complexity in the current state of the system. So by making the current state visible, we didn't design into the future state some of the flaws or some of the workarounds that we had for the current state. And then secondly, we mapped out future scenarios. We also mapped out and wireframed what those new service journeys would look like based on what we learned from understanding the current system. And all of this really worked through the model of moving from the current state, the concrete current state, abstracting it into a service blueprint, and then moving on to what could be. So this is the team here where they're really essentially mapping out and modeling what the ideal future state of this business could look like. But we didn't start there until we understood the current state. So we drew this model in the form of a service blueprint, and it forced us to be very explicit about the service that we were providing, to create the shared language of understanding, so that we also worked from a shared mental model. And then by describing the current state of the system, we were able to expose all of the components and levers and things that we use to essentially improve the current state of the system, remove complexity. So service design, what it helps us do is understand and improve how complex product service ecosystems work, to essentially design the kind of service that we want to do, to move from what is to what could be. Thank you.
So I'm Dustin DiTommaso from MadPow, and we are an experience design consultancy, strategic design, and I work in the field of behavior change and gameful design. So what I want to talk to you today about is how we think about combining design and technology to facilitate behavior change, whether that's healthcare, financial services, pro-social behaviors, but also human flourishing. So going beyond change to work on things of setting up goals for people to achieve the things that they want to achieve. Oh, my slide didn't go. Look at the timing. But when we think about using technology and we think about persuasive technology, there's two ways to think about it. It's designing to have users do what the designer's intent is, and there's design to help people accomplish the things that they want to accomplish, right? Help them facilitate that change that they want. And this is an area that I think is especially interesting, and this is where a lot of the focus of our work is. But when you break it down to an individual question, really it becomes, how do we get person A to do X in situation Y? We use a lot of theory behind it, so searching through literature, going through the greatest in behavioral economics, through motivational psychology, great human-computer interaction, and also we're finding that games and play as a construct is a very valuable and effective area to apply to behavior change. We'll talk a little bit about that today. But also why? Why do we care about changing behaviors with technology and using technology? Well, business, for one, has changed. We've moved from designing products of pure utility and usability to trying to design products to really target motivation, human motivation, and what motivates people to interact with products. And why do we do that? It's a differentiator from utilitarian products. Having things that are enjoyable, engaging, and pleasure as an outcome is a huge differentiator for products that are going to succeed in the marketplace. New business opportunities. Things like green behaviors, personal improvement, healthcare, using design and motivation to create products that have a lasting effect and an improvement effect on people. And we come to this by thinking about a Copernican turn in motivational thinking. So when we're designing, we're no longer thinking about the human as a rational actor from the 50s who's judging products and making decisions based on ample amounts of data. That is a part of a decision-making process, but also understanding that we are also a social animal, right? We are affected by our environment. We have emotions, we have needs, we have beliefs, we have attitudes. So balancing this cognition with more internal states and with our social circles and our environments is a big piece we want to strategize about. And that also comes about in a change from behaviorism, or operant conditioning and Skinner box and rats and pellets, to a more humanistic model of striving, growth-oriented people, and again, thinking about those two sides. And as a heuristic, there's a great way to look at it that's really simple, and Jonathan Haidt, in his book, The Happiness Hypothesis, illustrated this plan of this holistic model. Wasn't set up for behavior change, but it works really nicely. And what that does is it says that if we think of our two systems, our cognitive system and our automatic system, systems 1 and 2, that you can think of this as an elephant and a rider, right? Cognition is the rider, and your automatic system is the elephant. What does this mean to design, though, right? So in design, we want to create strategies that tackle both of these parts of human behavior and human understanding. So for the rider, we want to think about setting up those long-term goals for people, right, in behavior change, goal-oriented processes, weighing those decisions, but understanding that people get stuck mulling things over. And part of our job in design is to loosen up those sticking points, making things really easy to understand so that decisions can be made swiftly and confidently. And understanding that too much focus on cognition can slow a person down, can wear them down. With the rider, with the elephant, we want to understand that this is here and now, right? That we want to give people opportune moments to interact, to have instant gratification, to tie into emotions, to go into needs and wants and affinities, and applying to those things and understanding that, and a lot of times, this is a bigger piece of the puzzle. We need to get down to this layer before we can affect change over a long-term behavior and do that in a sustainable way. One other piece that was added in the book called Switch, which is understanding the path, right? So this is our environment. This is where the herd lives. This is where our physical and social space is, and being able to design products and services that also interact in these spaces. So directing the rider, right? So building that awareness, understanding that change starts from an awareness. Data visualization is great for this, so I can see where I am. Understanding that we want competence and growth. So again, visualization can see where we are, where we've been, and where we're going to. We want to be able to set up those abilities to develop new skills, to understand this is a skills building process, that change is not a single event. So when we design, we apply for a long path and map things out, much like Stephen has done with service design. So understanding what does that path of skill building look like? And thinking about the emotional side, right? So building self-efficacy and confidence, right? Overcoming personal barriers, diving deep into attitudes and beliefs, making sure that not only are there actions and items for things to do, task-oriented behaviors, but that we're getting to the core of learning. We're overcoming barriers and we're teaching people along the way to have the skills and the strength and the self-belief and efficacy to continue along that road. And then using technology and devices to put opportune moments and cues into their paths and traveling into a person's everyday life. So fitting in interventions to where people are and where they're going and making that a holistic combination of approaches. And if we think about this, and if we think for a behavior, for a person to perform a behavior, we know they need the capability, they need the motivation, and they need the opportunity to do this. So targeting each one of those through design, which we'll look at too. Really quickly, we can think about things as intrinsic and extrinsic. In motivation, we think about doing something for the internal joy, enjoyment of it, the pure pleasure of it, and then doing something for a separable outcome, right? And where we like to design is we like to think about how do we pull those behaviors closer to an intrinsically motivated state. We understand that on the outside, with extrinsic, people are acting for a reward, for a punishment. A lot of times in healthcare, there are lots of products that we see that are using strong incentives. Eat a salad, win $1 million, right? Move behavior change by giving these external rewards. And we know that when you pull that reward away, when there's too much focus on that extrinsic reward, the behaviors cease, the behaviors stop. So how do we internalize those values again? How do we get that into an identified state where it becomes personally important, and how do you tap into things that are important to people to keep them intrinsically motivated for the long haul? Also understanding that extrinsic versus intrinsic has this feeling of control versus autonomy, right? So we want to focus on being supportive rather than controlling. Instead of pointing a finger or demanding that actions be taken, how do we design in a way that supports people and supports their intrinsic motivations? And we do this based on a theory called self-determination theory, which we can use as a framework for design, which basically says that people engage and continue to engage in behaviors if they satisfy 3 intrinsic needs. Those are the needs for competence, or the ability to incur mastery over our environment, improve on a daily basis. This is a great tool for, again, data visualization. Autonomy, which is providing meaningful choice and the ability to make choices and feel like you are the locus of your own behavior. And relatedness, how do we tie people in a meaningful way to other people that mean something to them? So using these 3 things as a lens for design, we find is really effective for long-term behavior change solutions. So let's look at that for a second. A couple of products, and I'll show you sort of how we use these in the products that we design. Hot Seat is a gameful app that is targeting sitting disease, so getting people up and out of their seat every day. Sitting is the new smoking, right? So we know that, you know, one easy way would be to set a timer and have something buzz in your pocket and say, okay, get up and go, right? That's not enough. That nudge gets very easy to ignore after a while. So we wanted to build on those things of competence, autonomy, relatedness, and do that in a playful and gameful way. So you can see there's a bank of 40 activities. I can self-select things that I feel efficacious to do, and I feel like I'm willing to do that in my workplace. This is a tool for the workplace. So I'm expressing my autonomy through that self-selection. We have data that tracks our successes, our hits and mitts, the minutes that we do per day, so I can see that progress over time, and we nudge you up a little stronger every day. We ask for just a minimum dose of 2 minutes, make it really easy, build on that progress. We then tie in other people through gameplay, where there's a game mechanic in the game that says if I get 16 minutes of activities, when I get another challenge, I can then pass that to a friend in a cooperative way so that they can pick it up and keep my team alive, or to a rival and knock them out of the game and knock their team out of the way. So we have this mutually beneficial approach to gameplay that gets people staying engaged and active, so expressing that relatedness as well. Other things really quickly, taking a online program or taking an in-person program for NYeHealth, Diabetes Center, and they've been very successful in these 12-week programs to lower people's BMIs and lower their body weight for about 7% and have sustainable change of learning how to manage their diabetes. So we wanted to dive in and look at how we could do that in an online platform so that it could be available to more folks that didn't have the time to be there in person. And again, pulling on those core needs by keeping the group small, keeping them interdependent and mutually dependent on each other for success, so tying into that social bit, giving them, again, rich data, visualization, feedback on how they're doing over time, building on that progress, showing that competence, giving them the tools and the skills to learn. So it's not just about actions. So you learn a little bit more about how to manage your behavior, how to manage your condition, and wrapping that up into daily tasks, into learning activities, into physical activities, into social skills and improvement and support for each other. So again, it creates that holistic model for change. And then really quickly, an application for CDC for medication adherence for people living with HIV. So again, much like Hot Seat, where going into it, we thought that the easiest thing you would need to do is to give people a reminder to take their medication and what dose. And what we found with people living with HIV, the reminder was the least important thing, right? They're overcoming stigma. They are overcoming barriers of, I feel fine when I don't take medication. When I do take it, I feel sick. So overcoming that barrier. The idea that, does this even work? Is this going to do anything to me? And I'm in it alone. So we allow the user to bring in a buddy. So again, that meaningful connection, bring in one important person into your life to go through this with you. We give you a competence streak, so you can see how I'm doing, 13 days adherence. So there's a mechanic that goes up and down. Yes, there are reminders as well. And then long-term stats that we track our adherence. We can see that in various graphs and forms. But then when you get your quarterly blood tests taken, you can now see that the more I'm adherent, the better effect it has on my viral load. So tying in that lesson and that learning to build that sort of confidence. And then we can also measure mood, so we understand that when I feel better, I take my medication more often. So coming up with that holistic approach to change and using technology to meet people where they are in the moment, but understanding that there's a whole set of psychology and theories behind it that can inform design as we go through and create the products and services that we do. I think that's it. Thanks.
Hi, everybody. I'm Molly Lafferty, and I'm a senior interaction designer at Huge. So data visualization, it's a big topic. It's a really big, meaty topic that really deserves its own session, probably its own conference as well. And instead of getting down to the really tactical details of how you create really beautiful, impactful data visualizations, I really just want to give you an overview of, first of all, why we as designers are really excited about the prospects of data visualization. But then I want to spend most of my time talking about and giving you some insight into ways that we can kind of break free of how we're currently thinking about data visualization and maybe leverage it in a new way in the patient experience. So I really love this quote from Ben Schneiderman: "The purpose of visualization is insight, not pictures." I think if there's one thing that any of us on the panel would like you guys to walk away with today, it's this: that design is not just about making things pretty. that it's a way to approach problems, to drive insights, to craft solutions. And designers really love data visualization and working within data visualization because it's this really nice marriage between form and function. We are still primarily concerned with the function. What are we doing with this data? What are we trying to communicate? Who is using it? But really the value of design also comes through in its understanding of aesthetics, and that we can actually drive the interpretation and the usage of the data through really beautiful visualizations as well. So why do we visualize data? There are three things that really most any data visualization is doing. The first one is simply making sense. We are humans, we are visual creatures. We can only look at a table of numbers for so long before our heads explode. So looking here, this is the raw data from Google Flu Trends. This is a project that's been around for a number of years now, and it's one of my favorite examples of a really direct, clean data visualization. So Google's actually able to take a look at some of their search terms and model it to accurately predict flu activity across the United States. So what we're looking at right here is the raw data, and then when you're on the actual web page, you see this really clear and clean visualization. If you look at the top, you'll see the national visualization, and I draw two things from this really quickly. The first is that currently, right now, flu's not too bad. It looks like it's about average. Good news for people who still need to go out and get their flu shot. But then I see, oh, it looks like, I think this was last year, the flu activity was really bad in January. So it's a really quick way to make sense. Everybody could see that, could draw those conclusions faster than I could write them down and faster than I could tell you. What they're doing then on the bottom is they're starting to tie some of that data to location data as well, so we can look at trends across the United States. And that's one of the most powerful opportunities for data visualization, especially for data visualization within healthcare. It's identifying these trends and these patterns within the data and across data. What we're looking at here is a project from GE. GE has a lot of interesting data visualization examples on its website. This is the Health Infoscape. And what they did here was actually take data from over 7 million patient records, and they started looking at the correlations between common conditions with other conditions. So if you take a look at this and you click on a cluster of diseases, say the digestive system, we can start seeing how these correlate with other diseases. Now, these are just purely correlations. It's not meant to be a heavy-duty research tool. But I think it does a really nice job of showing how, first, something can be very visual and very appealing and make you want to interact with it, but also start kind of driving some questions that we can identify further. So why are some of these conditions related? Are there environmental factors, that sort of data to bring in? Can we look at genetic expression? It's really a good starting point to start bringing in some other data into the experience. But what all data visualizations do, and actually what all design does to a certain extent, is that it tells a story. And I think this telling a story, this narrative aspect of leveraging data is something that we're not quite comfortable yet, and we're not really taking full advantage of. When we talk about data visualization, we're really talking about these hard, quantifiable data points, and there's so much power and opportunity in that, and that's one area that we really want to focus on. But there's this other area too, which is just data, especially patient-generated data, that's maybe not so hard and that's not so quantifiable, but still can have a big impact in providing care. So to tell a brief story, in the fall of 2010, I got very, very sick, very suddenly, literally over the course of 6 hours. And I stayed that way for about 2 weeks. No one could tell me what was wrong. I was told I had viral pharyngitis, that I had the flu, that I just needed to go home and rest. And at some point during this whole ordeal, I mentioned to my gastroenterologist, hey, I started this medication. I don't know, maybe, what do you think? And there was this medication, this is Imurin, it's used to treat inflammatory bowel disease. And my doctor just kind of, no, you just have the flu. I kind of broke the cardinal rule, which is always obey your doctor's orders, and I took myself off the medication. Was 70% better within a day, 100% better within 3 days. And so I thought, this is interesting, that's an interesting pattern, and I really just started jotting down these data points, and they weren't really hard, concrete data points. I wasn't even taking track of my temperature, but really just how I was feeling, how my disease was progressing, and when I was taking the medication. 3 days later, I decided to take it again, and I was flat on my back within 6 hours. And when I brought this to my doctor, and it wasn't even any sort of robust visualization, it was really just these loose data points, he saw it immediately and told me never take that medicine again. At the time, I was a graduate student at Carnegie Mellon University, and I was doing a lot of work with chronically ill patients. And so that sort of inspired me to craft one of my research questions around this area. And that is, can data visualization help chronically ill patients communicate? And I don't know what it could help them communicate or how they would do it, but I was just really interested in learning a little bit more. This is the Healing Well online forum. I'm also a very passionate advocate about online patient communities, and a lot of my research was done in this area. I did a lot of long-form interviews, surveys, and even participatory design with many of the members of this community. And so I uncovered a lot through doing this research, and one of the opportunities I uncovered was this, the opportunity of patient-to-patient communication through data visualization. Something I uncovered through my series of interviews with these participants was that they actually have a tool on the site that they're currently using to vet information on the site, a way to put a lens onto these posts and to connect with other patients. And those are these. These are patient signatures. They're much like email signatures. But what's really interesting for the patients in this community is they started enriching these with really good data in terms of what medications that they're on, the amount of medication, whether they were in a flare or in a remission. And as a designer, I saw this and just thought, this is cool. What a great kind of easy win to start bringing some life to this data through a visualization. So I was able to work this idea into a larger final project. And it became something like this, which is this illness timeline. And so really all this is just simply visualizing the data that people were already putting into their signatures. So you can quickly see if somebody's currently in a flare or a remission. And then what's really nice is you can see over time how the medications they're on also correspond with their current flare and remission states. It's a really quick way to start getting patients to identify with each other, to connect, to help visualize their possible future illness scenarios as well, what the options are available to them, and ultimately empower them as well. There's another opportunity for patient-to-patient communication. So once patients are creating all of this data, there's a big opportunity. There are sites like Patients Like Me, Cure Together, doing some really awesome work in this area. Another example I want to talk about is Chronology. This is an amazing startup out of San Francisco. And it's a community for patients with inflammatory bowel disease. And one thing really interesting that they're doing is actually starting to kind of aggregate this data to get a picture of what treatments on the sites people are using. And so you can look at the current user's health, how many people are actually on that current medication, and how they're currently doing health-wise. Now, you might not be able to draw any sort of hard conclusions for this, but it's a really powerful tool, especially within the community itself, in terms of connecting people to each other. So what I really like what he's doing here is has this users tab, so you can easily connect with other people who are on the similar treatment and find support and knowledge that way. Lastly is patient-to-provider communication. And this is a big one. This is a big topic, especially when we start talking about integrating patient data into an electronic health record. And I know this was a topic of discussion yesterday as well. But before we solve those challenges, which I know we're going to solve, there are still opportunities to start bringing some of the data into the setting as well. And there's two ways to look at this. The first is this initial visit. So we've been faced with these time and time again. This is just sort of your medical history, that first form that you fill out when you're going to a doctor. For people with chronic illness, they're going to a lot of specialists oftentimes, and they're telling their story again, and again. These forms themselves, they're also just terribly designed. There's never enough room. They're never writing enough questions or really getting the right amount of information. There's also this interesting thing that happens is that a patient fills it out and they hand it over to their provider. And it's almost like there's a little bit of loss of power in that situation where all their data, it's suddenly handed over, the doctor gets to look at it, kind of gets to decide what the talking points based on that information provided is going to be. So what if we went from something like this to this? And this is a medical illness timeline that was actually designed by Katie a few years ago. And she was in a situation where she had a history of a chronic illness. She was going to see a new specialist and really just wondering, how do I communicate my experience? And what she's showing here, it's not really grounded in any sort of hard data, but it's really how she was feeling through these times and the big milestones through her health history. And through this, she was able to do two things. The first is she was able to start seeing some correlations between her primary chronic condition, as well as the issue that she was going to see the specialist about. And then it became this really nice shared artifact with the provider. And I think this is a big untapped opportunity area When we talk about the idea of partnership between patients and providers, we really need more tools to empower patients, and this is one thing that we might be able to explore. And really quickly, another opportunity area is just the idea of the ongoing relationship. This is a really awesome project called HGraph. This is an open source project that's looking at visualizing personal health information and data. And so it's pulling in a lot of information that would live within a personal health record. So we have cholesterol, you can dive down into that and actually get the lab results. But what I really love that they're doing is this. They're starting to call out things like exercise, sleep, happiness, stress, things that aren't as easily quantifiable depending on your access to some of these quantified self-tracking devices. And so what happens is you can get this whole rich picture of the patient's current health. It's tied to a score, but it's really quickly, you're able to see if the exercise falls within the inside of that ring, they're not getting enough exercise. The same with sleep. And what I really like that this is doing is actually giving this full picture of health. It's not only a way to maybe aid in a diagnostic tool, so for instance, we see the patient isn't having enough sleep, is there a medical issue that could be causing that, but also leads us to communication and to conversation about, okay, why aren't you getting enough sleep? Is there something else going on in your life outside of any of your health problems? Are there ways that we can address those as well? Thank you.
So thank you to the three of you. Those were really wonderful talks, and I have like 10,000 questions that I want to ask, and I guess we'll just see what we can get through in the remaining time. And I think what's really great is these three topics really interweave in a lot of ways. Service design, user-centered design, behavior change, data visualization. One thing I wanted to talk about first is relates to what Steve had talked about with service design and creating models of systems and visualizing systems. And I know as designers, all of us have kind of come up against the need to visualize a system. And I just wanted to ask what you've learned from visualizing systems and what you've been able to kind of, what your big insights have been.
Sure. So, like I alluded to, I think the one thing that the visualizing systems and the way that we've been doing it with service blueprints has helped tremendously with is that you in a large organization that has a system like I had described, there are so many competing and conflicting points of view about the service offering within the organization. And the biggest insight is that by making it visible in a visual way, you suddenly have a lot of aha moments throughout the organization where they see a certain piece of the service journey that they didn't know that it worked that way. And getting everyone, maybe not completely aligned, but getting them aligned around an artifact that's on a wall was hugely powerful.
Yeah. Do you guys have any examples?
Well, so for us, we do a similar approach where if we're working through behavior change over 12 weeks, 16 weeks, 3 months, 6 months, 8 months, 12 months, we want to outline what that journey looks like for the patient. We want to understand, where they're at, what biometrics might change, where the product interacts with them from a day-to-day basis or a weekly basis. How often do they need to check in? Understanding that we're not going to be able to map change exactly well, but we can see where the pain points are going to be within that process. If I'm managing multiple conditions, if I have multiple competing goals. And so we can build a path and a hierarchy so we know what to show people at the right time and when. And that enables us to really think through where problems are going to happen and meet those problems through design before they actually occur.
I think there's also a lot of value in when you're developing a new product, especially within a large organization, is starting to visualize what's the place of that product within that larger organization, that larger ecosystem. How are you driving users to use this product? Where are they going from your product, if anywhere? How is data getting into it? How is data leaving? And so I think visualizing systems, there's a really good opportunity to sort of place whatever you're developing sort of at the system and really focus on those in and outs.
Yeah, I know, just personally, I had a client who's from a large telecommunications company, to remain unnamed, and we were doing some work for them, and we did this visualization of their ecosystem, their kind of entire kind of ecosystem anywhere, any customer touch points. And he said, you've put together a model that helps me understand my company in about 2 minutes that actually took me about 6 months to learn when I first started my job. So it really kind of externalizes these processes and these touch points and relationships that are hard to kind of hold on to in your mind, it seems.
Yeah, I think that's a good point. When I work with organizations and we build these service blueprints, I always encourage them to put them up on a wall where the whole organization can socialize around it. And this is not for existing employees, but also for new employees and even new consultants and new partners and vendors that they engage with, so that if they're willing to share the bird's eye view in many cases of the service model.
Yeah, definitely. So in addition, Molly has spoken really well about visualizing not only systems, but patient data and patient information. And so, we've heard about how this could help patients communicate with their doctors. You spoke a little bit about self-tracking, and I actually think self-tracking is an interesting concept that fits into our discussion that we haven't really talked about a lot explicitly. But self-tracking is basically kind of keeping track of your health behaviors so that you can learn about yourself and kind of make changes. It is also a difficult behavior to keep up, and that's where kind of Dustin's conversation or work comes into this. Like, how do we help people, and especially patients who want to self-track, how do we help them do that better? And I know there's a slew of apps out there all about self-tracking. It's just difficult to keep up with those.
Yeah, so in our experience, there's a few tips that I would offer. Making that tracking as easy as possible. So any things that can be automated. Now that's really easy by using devices to track your steps, like a Fitbit or a mobile phone. It gets really hard at the moment to track things like nutrition and diet. Until we have a toilet that can track all that stuff, it gets a little difficult. So you're asking people to, actually, manually enter what they ate today, and that can get tiresome really quickly. So we like to try to overcome that. Again, still keeping that easy. We try to make that a little bit fun, using design to make that an enjoyable, a rewarding experience, but also showing the salience, showing why, teaching them the value of why they're tracking. So what's the benefit on the outside? Highlighting those outcomes that are either going to be far down the road and making them easier to reach, so breaking up the long-term goals into short-term goals and showing that progress over time, tying that together with the process of tracking. So it's at one point making it easy to do, and then at the other point keeping it motivating and stimulating by showing success and paths of success.
And how does data visualization fit into all of that? So you're wanting to show people their progress. I know we've talked about this a little bit, but what's a great example of an app that uses data visualization to help you kind of continue on this path of self-tracking? Does anything come to mind?
One of my favorite examples, it's so simple and yet it's so effective. Have anybody heard of the Seinfeld method? I don't know if this is an urban myth or something, but Seinfeld was giving an interview. Somebody asked him, how did you get so good at writing jokes? And he said, I had a calendar, I had to write every day, and I had to check off the box every single day, and I didn't want to break the chain. And there's something so powerful about not breaking the chain. There's an app out there called Lyft that's really focused on habit forming. And it was actually something I used myself. I wanted to floss more, didn't have very good flossing behavior. And it's really simple because you can check off if you did that behavior that day or maybe if you took your medication. And it just creates on a calendar this nice chain, and you see a green for every day. And there's something so rewarding about seeing that square turn green, but then seeing that chain and just continuing that chain to the point that I understand the principles behind this. I understand exactly what they're doing, but I would get to the bathroom at the end of the night, and I'd want to skip the floss, and I'd be like, no, this is just, it's so easy, and yet it's going to be so satisfying to actually just click that and to see that chain keep growing. So I think there's a lot we can do with data, and there's a lot of complexity that we can do with it, but we also need to identify the areas where it's really better to just keep it simple.
Yeah. And thinking about self-tracking, which, by the way, Steve Dean also organizes the Quantified Self Meetup group in New York, so he's also an authority on self-tracking. Thinking about, in the healthcare setting, patients self-tracking and then bringing that data to their doctors. I think this is something that has been that we've been talking a lot about, and certain doctors are more receptive to it, certain doctors are less receptive to it, but that does seem like that's the direction that we're moving in with encouraging patients to keep track of health data. I guess this leads into my question of behavior change, not only on the part of patients, so getting them to self-track, getting them to keep track of information and understand themselves better, but how do we help providers and the healthcare system be able to accept this information and use it in a clinical setting? So how do we help change the behavior of on the provider side?
So I'll respond to that by just describing an example of a project I worked on a couple of years ago with a startup called Asmaplus, which is now called Propeller Health. And so the invention that they came up with, which was quite genius, was the problem they were solving is how can we get real-time epidemiological data on asthma outbreaks around the country. And this was invented by an epidemiologist at the CDC who came up with the idea of essentially putting a sensor onto an inhaler, an asthma inhaler. Makes perfect sense. So you put a sensor on, you record the timestamp, you record the location of that asthma outbreak. So you now have real information that's come back to the patient about when an asthma outbreak occurred, and then you can obviously look at this in terms of insights and patterns. But what's nice about it in terms of the question that Katie asked is that if you can introduce these kinds of innovations into systems that providers already have to tap into, participate in, be a part of, to help them get to an assessment of one of their patients' own understanding of asthma outbreaks and how often it occurs, they're going to participate in that. And I think Asmaplus is a great example of an asthma patient being able to come in, and if you ask them to recall how many asthma outbreaks they had in the last week, recall for most everyone is pretty difficult, but being able to give a much more accurate representation of what's happened in the last 7 days or the last month makes it much more effective for the provider to treat that patient. And I think these kinds of wonderful closed systems with great feedback loops are going to make it more impactful, more powerful, and I think lead to providers changing their behavior around involving and getting involved in these kinds of systems.
Yeah, I know just Molly showed the health history timeline that I had put together, and the first doctor I showed it to was not so excited about it, but the next 10 to 15 doctors I've showed it to have all been really psyched, and one said, like, you go girl, or whatever. So it was, I think that for the most part, if you're bringing something to the provider that has a clear value, that's easily readable, that's, it's much better than bringing in 2 journals full of pencil notes. Right. If you can help them make quick decisions and quickly understand what's going on with you. And that's where I guess design comes in, creating those tools in a way so that information is easy to pull out of them.
Yeah, and I think a lot of Steve's points about visualizing systems, it's really valuable too. So if you're looking to develop a tool that's going to be used within the provider setting, you could do sort of a journey of the current state. How does a typical office visit go? You could look at that, visualize it, and then once I develop this new tool, how is that actually going to change things? And that can help you identify possibly some pain points on the part of the provider or the nurse that actually might impact their using that new product.
Yeah, and Molly's talking about workflow, I think, as well. So how do we make sure that we're creating designs and products that fit well into the workflow of the doctor, of the provider, because we don't want to ever slow them down. That's probably number one thing. We want to just help them be as fast as they can be. And so I spoke briefly about that at the beginning of the talk. We really need to understand the people who we're designing for and their needs and their context. So I know we all have a ton of experience with this. Just briefly, what are some of your favorite ways to understand your users? And I know it depends on the project, depends on the context, but just for the people in the room.
Let's see. So in the projects that we do, most of our work is set up with a sort of a medium-sized research phase where we do a combination of ethnographic research, user interviews, stakeholder interviews. To understand, we want to understand what's the problem space, who are the people that we're creating products for, what are their challenges and barriers, how do they think about their condition, what are the things that they are worried about most, how do we reduce their frustrations and pains, and what's it like on a day-to-day basis to manage a condition or to try to overcome a health behavior that they're struggling with, even something like smoking cessation. What are those opportune moments and what are those barriers? And understanding from a business context, what are we looking to achieve? What are the metrics that we're driving towards at the end of this intervention? What are the targets that we're trying to hit so that we're all on the same page of what we're going to achieve and what, we know success when we get there. What does that mean? So understanding all that up front builds empathy, gives us targets to hit, and then we can use both of those things to design the intervention cycle for that.
Traditionally, when building new products, we've gone off and built the product ourselves. This last project that I worked on that I showed you, we have an expression in the design field, service design and other design fields, called participatory design. And what we actually did is we had individuals who were using the service. These were patients or participants is what they called them. And we brought them into the room with us when we had these blueprints up on the wall. And there is nothing like watching their expressions in their face. They feel so empowered to be involved in the process of coming up and designing a service that's going to impact them. And they're more than willing to give up their time because they get to participate in something that's, one, it's outside their field, but it's so focused on their own needs, and they already have a relationship with that health system and that organization or that brand. And involving your end users in the process of designing the future state or the new systems is an incredibly powerful and effective tool that we found that we've been using for the last several years. We call it participatory design, but it is bringing those individuals, whether they're patients or members, into the design process.
Yeah, and I think all of us, we may have slightly different processes, but it is of the highest importance to all of us that we find ways to speak with our users or involve them in our design process. Otherwise, we understand that we're really just designing for ourselves, right. and we don't ever want to fall into that trap. So. Yeah, I actually wanted to come back to the Asmapolis example because it's not only a great example of personal data collection, but Asmapolis did some interesting things with all of the data that they had for all of their users. So they actually were able to create a trend map of where users were having more asthma attacks. So that's just kind of one way that we can use sort of big data to find out insights about healthcare. What are some other examples of sort of big data? I know, Dustin, I think you had a project that you guys were working on.
Yeah, so over the last couple of years, I've been working with GE Healthcare Economics on a product that helps hospital entrepreneurs or decision makers decide where to build facilities in developing nations. So the product's called Corvix. You can look that up. There's a lot of press on it. But what it is we have maps of areas of India, of the Kingdom of Saudi Arabia, where we have population data, we have health data and economic data that you can graph onto a map all the way down to district level. And you can see what is the prevalence of cardiovascular disease, what is the all-cause mortality rate, what's the population, what's the GDP here. And you can decide where to build a hospital. So you can actually drag a hospital into a location based on what you're looking for. You can configure that hospital, so now you can build it out by cost, depending on equipment, throughput, what kind of services that you're going to offer. And there's agent-based modeling behind that as an engine, and you can see what kind of effect that has on the population health data over 20 years, as well as what kind of impact that has on budget costs and return on investment. And you can do a few different choices. So I can put 2 hospitals in this region and 1 here, or 1 here and 2 here, and I can find that best return, map that out, and send that to other decision makers to decide where and when to build facilities. Really powerful stuff.
So it's basically you're able, and I put that up.
Oh, cool.
You're able to help decision makers who might have to dig through, might take weeks and weeks or months and months to make these decisions. You're helping make these
Yeah.
decisions more visual?
The
easier?
process before, I mean, that data exists. There are keepers of this data, but this process before would take weeks. There were literally spreadsheets and spreadsheets and spreadsheets, really amazingly designed spreadsheets, where you'd have to plug in all these numbers individually, meet with people, show them, adjust the numbers, do it again, and this was a huge, really overbearing process that was prone to mistakes. So by tying that all into this really intuitive interface and having that data be the engine behind it and model the predictive behaviors, the outcomes, it's been really successful.
Very cool. I just found another, GE seems to be the big healthcare visualization organization, but they worked with Pentagram a few years ago to come up with this visualization of how hospitals are performing. And each hospital was rated along certain metrics, and this was data that was publicly available, but they just put it into this format. So you can basically explore this interface and find out how hospitals are performing in your area. So this is just another way of taking this data that does exist, but sort of making it easy to comprehend and easy to explore. So I think everyone is talking a lot about how big data and healthcare, but these are, I think, just some interesting examples. Anything else come to mind for you guys? Yeah, cool. One thing, I know we have just a few minutes left. I wanted to make sure that we talk just for a minute about kind of what the risk is of just building something without kind of going through these processes that we've spoken about today.
Yeah, I alluded to a project that I had done about a year before this last one, and I had instructed the organization that it was very important that we model out the current state of the system, and they decided against it. And I think the risk that I saw is that we would essentially design into the new system, the future state of the system, a lot of the flaws or the workarounds or things which were designed in the system to deal with some inefficiencies in other parts of the system, but doesn't mean that needs to be made part of the future state. So the risk for us was that we were redesigning an entire platform without complete and full knowledge of how the current system worked. And the risk is that we were designing some flaws into the system.
I also think there's a risk of spending a lot of money on maybe a new flashy technology without really understanding what that technology can solve and what the benefits will be. So the Google Glass demonstration earlier was really great, really exciting. But without those processes, what might happen is that you end up spending a lot of money and time integrating a technology like that into your workflow without actually understanding the current state and maybe the other opportunities that Google Glass could provide.
I'm going to agree with these two.
Yeah, so we're really concerned with solving problems and understanding the problems that we're solving before we start designing and creating.
Yeah, I have one really quick example that I like to give on this. A client of mine had come to us and wanted to design an iPhone app for a very specific population of asthma patients. This is separate from Asthmapolis, another project for asthma patients in a disease management program. And they gave me a whole set of requirements, and what I did is an exercise with them we call behavior sequencing, which we stepped through all of the behaviors that the individual had to go through in order to complete this questionnaire that was asked every 30 days. Something called an asthma control test. You've got to ask the patients every 30 days these 5 questions. So I put them in a room and I had 55 individual Post-it notes that was verb noun, was a behavior, and each one of those is a fail point. And we looked at that, and on the other side of the wall, we did a simple text messaging solution, which had about 4 steps in it. And part of the exercise was to also reveal that you don't, like Molly says, you don't have to always start with the iPhone app. We have to start with what the problem is that we're solving, and then look at that audience and figure out what's the most appropriate technology platform that we use to get that, to make that effective. Because the first behavior in the sequence of the iPhone app was buy an iPhone. So I asked the company, are you going to buy an iPhone for your 1,000 patients in the disease management program? Because that's a behavior that's difficult to get to occur as well. So we exposed all the failure points and we looked at a much simpler solution knowing that 99% of the patients in that program had the ability to send and receive text messages.
Nice.
Great. So in our last couple minutes, I just wanted to ask if you could impart onto the audience what you think the one or two most important things they could do to bring their organization toward more of a design mindset.
Involve patients.
Yeah, involve your patients or your audience for sure. Participatory design is awesome.
Yeah, and not just patients are incredibly important, but also providers, administrators really think about the whole ecosystem of people that might be directly or indirectly impacted by the project.
And just a plug for the organizers of the conference. I know Molly and I are patients, and we come from the patient perspective. I think it's also really powerful at events like this to include all stakeholders. So patients are 50% or more of the healthcare equation. And to bring patients into events like this means that you're talking with them not just in a clinical setting. And I think that can be really powerful and can lead to design changes in the way we practice medicine and the tools we create. So I think we might have a minute or two for questions. Okay, yeah.
Hello? Yeah. My name is Ivan Handler. I'm the CIO of the Illinois HIE. One of the things that struck me is that the processes you're talking about going through, in an RFP, we know about one recently that didn't work out too well. One of the things that happens is the first 3 steps, gathering requirements, understanding where the gaps are, getting some sense of where you want to go. We all do that with a lot of, unfortunately, large and fairly lumbering consulting firms. The RFP, a lot of reasons why things fail big systems, especially with government or big industry, is that if the RFP is not constructed really well, if we don't really know what we're doing, then it doesn't really matter who wins the bid. And I think the issue that happens the most, and this is where I think some of your techniques are really fascinating, is that when you start asking people, well, what do you want to see? And you take usually old examples of an RFP and you try to go and shoehorn the new stuff in, people get what they started with, one way or the other. And the really important thing, because people are in the trenches, they don't have a lot of time to think creatively, and I think what might be really interesting for you all to think about is how you could bring some of these techniques so that the people who are the stakeholders who are going to really be responsible for the content of these huge documents can really get some insight and make the leap. Because in my experience, what I've seen in a lot of these big things is people don't make the leap. And at that point, you can tell it doesn't really matter who's going to win. We know what's going to happen. And I think that's a critical kind of thing because in many cases, the design process starts way, way, way before the official design process starts. So that's just an idea. I thought I'd share that.
Yeah, thanks. And I think before those documents are written, you can use, we teach workshops on how to do this sort of framing and, design approach, much like, the journeys that Steve is talking about, but you can do those internally too as a, step 0 before those RFPs are written. Take a day, take 8 hours, and then take another day to sort of collate all that data before you form your opinion and your direction of what's going to go into that RFP.
Okay,
Great.
that's fine.